Tracy with MeatRx. I'm a MeatRx coach here, and I'm here with Dr. Elie, and he's going to tell us all about his success story. He's a board-certified physician in internal medicine and nephrology. His practice focuses on caring for acutely ill patients admitted for a myriad of medical conditions. Elie has taken a radical departure from mainstream medicine and used lifestyle to completely alter his health. This firsthand experience shifted his professional interest to include nutrition as his primary tool to combat chronic metabolic and autoimmune diseases. And he's going to share with us all of his success story and how this all has been going for him. Hi, Dr. Jarrouge.
Hi, Tracy. Thank you for having me.
Thank you for coming. So can we begin by just telling me what was your life like prior to coming to a meat-based diet? What kind of health conditions did you have, and what kind of foods were you eating?
Sure. I grew up in Lebanon, so it was traditionally meat-heavy place. So I never thought of my health. I've always been slender and slim. But after moving here and going through college, I went from that to Pop-Tart and muffin diet between classes, and then just chasing the next crash. And then again, I was young, so I didn't think much of it, and then went to medical school, just the same amount of type of food, fast food, jumping on buses or whatever, just eating whatever, Taco Bell or McDonald's. And then slowly the waist started increasing. I mean, when I was 18, I was size 32. And then by the time I finished medical school, I was close to 35, 36, had gained 30 pounds. Again, when it happens slowly, you don't notice. And then I noticed my blood pressure was getting high in the 140s, and I was only in my 20s. And my dad had high blood pressure. I thought it's genetic. And then pre-diabetic, my A1C started running a little bit on the borderline. And again, I honestly didn't know what to do. I was like, just need to exercise a little bit more. So I went through internal medicine training and, long hours, bad food, you name it. So it's only made it worse. So this is where when I was about to start my actual full-time position as a hospitalist, my back gave out like 2 days before. I was actually trying on pants at the mall to look for new pants because the other ones were getting tight on me. I just gonna look professional for the hospital. So my back gave out, and I was on the floor for 2 days, and I had to force myself to go to work. And I still have the cane that I used 8 years ago to make it to the hospital and see my patients. So for 2 years, I kept having flare-ups of this. I never understood why. Physical therapy, and non-steroidal, exercise. Every time I try to exercise, I throw out my back. If I try to do yoga, I throw out my back. I bend over, I jump, throw out my back. So this is when I realized I have to do something about it. And I started with, initially, I didn't know anything about keto, carnivore, anything. That was 2014. At the time, the Whole30 was a popular thing. And then my wife gave me the book. It's like, you read the book, you're a physician, read the science part, and then and do that. Just do it. What do you have to lose? And I did it for first month, lost like 15 pounds. And then next month, another pound. So 20 pounds in like 2 months. It felt great. I was like, okay, good. I can stop now. So I went back to my old habits, and then I had another big episode of throwing out my back at the gym. And that lasted about a month. And after that, I was like, I need to do something. So started back this time, more paleo. Then 6 months to a year later, I felt I need to change something. I didn't know what it was. So I was interested in keto because I learned a lot about it, but I was afraid to try it. But then I dived into it, and I did that for 3 months. And I lost another 10 pounds. So now I'm down 30 pounds. I was like, okay, I'm back to where I was. Then I had this keto rash that very few people get, and it's like very itchy, like right in the center here, and I get on my back. Researched the heck out of it and didn't find why. People thought, it's the ketones or it's liver inefficiency or whatever it is. until one day some guy told me at a conference, "You're not eating enough protein." I was like, yeah, keto is kind of high fat, moderate to low protein. So what the heck? So I had to stop because it was unbearable. I really lived with it for 3 weeks to see maybe it goes away. It never went away. When I started eating more protein again, that kind of slowly went away. And then I felt better I didn't know I could feel better, but I still felt better. And then slowly start eating more and more meat. It just became more and more my preference. And then met, Sean's, on Twitter and Instagram and YouTube channel. And then I became more and more interested in that. So I'm not a carnivore per se, but I'm heavy meat-based whole foods diet. As long as for me it's just, and even when I went more like carnivore, I did actually about a month of that. And then another 4 or 5 pounds came off, and I had no idea that was even possible. So it became lean, working out, muscle mass is good. Now I feel great. So that's my story in a nutshell.
Yeah, it sounds very similar to mine. I had high blood pressure and pre-diabetic and that sort of thing. I did the Whole30 also. And
you did, yeah. It seems like a common story. Whole30, paleo, you do keto, then you become carnivore-ish. And then you go out and start preaching.
Right. I couldn't keep up with the keto because to me, if I had a little bit of carb, I wanted a whole lot of carb. That didn't work too well for me. But yeah, I was totally the same except for the keto rash. Now that's a little different.
Very few people, and I researched it. It just didn't make sense to me. But all I knew is that I feel great, my mind's sharp, everything, but my body is telling me something that's not right. So I don't want to accept that. And I experimented and discovered that more protein seems to help. I don't know why. Maybe I'm not as high of a ketosis state in general. I don't measure my ketones anymore. The few times I measured on carnivore, it's low ketosis, which I'm more than happy with. But I was pushing my ketones to go up as, experimental and see how you feel and all that stuff. So definitely has its role. It just, I gained the most I could get, and then I needed to kind of find another balance for myself.
Yeah. So does anyone in your family do carnivore or keto or heavy?
So, slowly over the years, it took a lot of work, but slowly I've gotten family, friends, in their own health because they have their own issues, weight or, back pain, whatever, hip pain, mental fogginess, generally just not feeling well. And then it took a while to convince. I was preachy initially and then realized I was turning people off. Eventually I just did my thing and then, hey, if you have any questions, I'm here to help you. And really that inertia initially is the hardest part. Once they start, then it's much easier to continue. So now I have at least 4 or 5 people in the immediate surrounding that they're on a version of a carnivore, meat heavy, keto. I don't label anything, but basically a high protein, animal based, very low carb and moderate fat intake. A friend of mine, close friend of mine, is down 50 pounds in like 2 months, and feels great. My sister is down. I mean, it's like the slimmest she's been in years and years, and she feels great. And a lot of other people too, and then some patients I work with. So it definitely works.
Yeah, definitely. And so you lost your weight, and your keto rash went away in a short amount of time, or after you started?
I mean, within a day or two, the inflammation, that angry look, it starts to subside, and it takes about a week or 2 for the rash to go away. Again, I don't know. I mean, I loved how I felt on keto, so I'm not saying keto is bad. I'm saying I was one of the few people who had a keto rash, and increased my protein intake did the trick for me.
Mm-hmm. Yeah. So you love to tell the story, and you're helping your patients currently with the meat-based diet to help them get off medicines and.
Yep. I mean, I started kind of an online, kind of remote telemedicine type thing on the side, coaching thing, and people who reach out to me and they need help, and talk to them, and then if they want to sign up, I really coach him over a good like 4 months. Because I struggled, we all struggled. And even as a doctor with all the medical knowledge that I had, I failed several times before finding the right balance. And I realized there's no one right answer. So it depends who you are, what kind of issues you have. So, somebody who has autoimmune diseases and really bad, I would tell them to go straight carnivore all the way, for instance. But if somebody has diabetes and they really don't want to change the lifestyle much, it's small steps, cut the sugar here, carbs there, start increasing your protein to be full. So it's definitely a tailored approach, not dogmatic about anything. I start where you are as a person and then take it from there. So far it's worked.
Oh, good. Yeah. And so the ones that have autoimmune issues, do they have a harder time adapting to the new lifestyle, and does it take them longer to heal?
I think it depends how bad their autoimmune disease and their advice that they're getting. I think if they're desperate enough, I haven't treated a lot of them, but the people who did, because they're more desperate, especially if it's Crohn's or ulcerative colitis, they're really miserable. And they're more open to ideas. And if they struggled on drugs and lower immune system and stuff like that for years, they're more open to new advice. So these tend to try it and then feel better in a relatively shorter period of time. The healing may take longer, but they definitely work. And everybody's a little different too.
Yeah. So what do you recommend on exercise, and do you exercise?
I did not exercise for the first 2 years because of my back. I was so afraid because every time I signed up in a gym, I went for a month, and then I paid for a year. I didn't go because every time I tried to do something with weights, my back gave up. So I was really paranoid about it. So I just got healthier. I lost all the weight. And I looked good, and then I knew I wanted to exercise because I cared about muscle mass. And the more you hear about aging and lifespan and all that health span, I don't want to be wheelchair bound when I'm 70, So I started looking into weight strength exercise or resistance training. Jerry Texeria on JT on YouTube. He has a really nice. I started following when he was starting, and I made a lot of sense, and I started doing that. And I'm lazy when it comes to workout. I don't want to work out for a whole hour or two every day. So I started doing that just at home. I bought a bar for pull-ups, and I just do my push-ups and squats and variation of that based on, and then I started getting stronger and stronger. I went from doing 2 pull-ups, 3 pull-ups, so now I can do 13, 14 pull-ups. Push-ups and squats and all the same. Muscle definition is better. So I work out maybe 20 minutes, 3 times a week. And then I'm going to try. It depends also what you're trying to accomplish. I wanted to build some muscle, but I want to become Hulk. I just was trying to be toned and strong. So that's my happy medium right now.
Yeah. And the meat puts muscle on you anyway.
Oh yeah. It doesn't take much. It's interesting because I only do like 1 set of whatever I do until I'm like exhausted. And that alone is just a combination with enough protein in your diet. You can see results relatively quickly. So that's my advice to people too these days.
Right. Okay. So that's great. So if someone wanted to hire you to coach them, where do they go to do that?
Right now, I have a website, metabolichealthmd.com. I created my own website, so don't judge my website, but I did my best to create it. But the way I have it set up, I have basically programs. You have a metabolic weight loss, medical weight loss program, and then diabetes reversal program, or any really program because they overlap. And that's usually a 16-week program, because I do think people who need help, it's not a one-time thing. It's kind of a hand-holding and advice over time. So I have a form they can fill. I can give them a call, chat with them for a good 20 minutes, 30 minutes, and see what they're looking for. And if they're a good match or I'm a good match to them, they want to hire me, I'm more than happy to sign up with them. I do it online, so it's all from home if they want to do it, and then we'll just work around their schedule. And then there's also obviously the initial, just a one-time consultation. If you want an opinion, I'm happy to do that. Again, I do this because I want to help people. I do have my full-time job, so I only care to help you if you want to help yourself. You know.
Right. Yeah. So you work in the hospital, and I heard that the hospital food's not too good there. How do you work around that?
Surprise. Well, the way I look at it, patients are in the hospital to get over their acute illness, stroke, a heart attack, surgery, anything like that. And it's every hospital, so I think everybody's trying their best, and that's what's available. And I'm too small to make a difference in that. Plus, I don't want to spend that much effort to try to change that. It takes a lot of policy changes and at the government level to trickle down. So all I can do is educate patients that certain food that's not making you healthier, that's making you healthier. And then if they're open to discussions, I'm more flexible during the day, running around the hospital, so I can spend good time with them and educate them, and then hopefully they follow. I mean,
That's good. That's good. So is there anything that surprised you about being on a meat-based diet that changed in your body besides, I know you said you lost weight and everything, but I didn't know if there was anything that surprised you about being
Yeah, I mean, first of all, clarity and lack of energy fluctuation. I drink coffee because I enjoy coffee, but I even tried to go without coffee for 2 months, which I did, and I had no problem with my energy level. So that's one. Two, inflammation. Sometimes you don't think about it, but I used to have like a left knee ache sometimes, with maybe and then I never felt that since then. Back pain obviously is gone. Strength, desire to do stuff outside, desire to live seems to be a little bit more than pre-health,
Yeah, definitely.
Skin is good. There's no like pimples or anything like that, and
Yeah, cool. So thank you so much for sharing your story with us. I appreciate it very much, Dr. Elie. I really enjoyed talking with you.
Thank you, Tracy.
And so people can hire you as a coach, and I know you have your busy schedule at the hospital being a doctor, so
yep. And they can find me on Twitter if you want to hear my opinions here and there. Mm-hmm. So that too.
Okay, and where do you go by on Twitter?
My name, Elie Jarrouge, MD.
MD, okay. Awesome.
And then, so I'm trying to be active there. I started tweeting about 2 months ago, and people are finding value, so I'm doing it more to see what happens.
Awesome. Thank you so much, Dr. Elie.
Thank you, Tracy.
Okay, we'll talk to you later.
Talk to you later. Bye.